may one more on
Yeah.
Rachel Levine. Her confirmation has gotten a lot of opposition from Republicans, specifically about the COVID nursing home scandal. She's implicated in Pennsylvania for signing a directive on May 18th while taking her own mother out of the nursing home. There was always 12,000 senior deaths. That's half of the deaths, COVID deaths in Pennsylvania. This is the same scandal that Cuomo is facing in New York. And the governor in Pennsylvania is under investigation. So why does your administration feel that Rachel Levine should get a pass on this and get such a high official position at the Health and Human Services Department?
I have to look into more specifics of the details here. It does not sound at all to me like that her scenario is similar to the scenario in New York, but we'll follow up with you if we have more to offer. Go ahead in the back.
Thank you. Just first to follow up on Alex's question about the remarks to the Senate Democratic Caucus tonight. Is there a reason why the press pool was allowed into the remarks to the House Democratic Caucus and that is not the plan for the Senate Democrats? Was that something that was a White House decision or something that Senator Schumer and company decided?
I'm happy to check on the access question. I certainly know that you guys like to have access to these these events. I will check and see what's possible.
And then a question on a foreign policy topic, which I think you're familiar with through the years. Senator Menendez is leading a group of senators who are pushing for the White House to recognize the events of the Armenian genocide as a genocide rather than as atrocities of some general form. Is there any update on the planning on that?
We're certainly aware of Senator Menendez's efforts, but I don't have any update on our policy. Go ahead in the back.
Yeah, President Biden said yesterday that he regrets Turkey's withdrawal from the Istanbul Convention concerning violence against women. Is it to say that he has no capacity to make the difference on values with this ally?
That President Biden has no capacity? Certainly, we hope that's not the case. Turkey is a long-standing and valued NATO ally. We've shared interest in countering terrorism, ending the conflict in Syria, and deterring malign influence in the region. We seek cooperation with Turkey on common priorities, and as with any ally, engage in dialogue to address disagreements, as this was a case and evidence of. Okay, two more, and then I gotta go. Go ahead.
Dr. Walensky in the briefing
Yeah.
just now raised a warning that cases are starting to tick up again. Of course, we're seeing footage of people outside, big parties, et cetera. Governors have been lifting measures. Is the White House, is the president concerned that we're going to have a new wave in the U.S. before vaccinations get in arms? Is this a question of the trajectory we're on or could be on?
Well, I'd certainly defer to our health and medical experts, including Dr. Walensky, but I think one of the messages she has been sending very consistently as the head of the CDC is that we need to remain vigilant, and this is not over. We are still at war with the virus. 1,400 people are still dying every day. That requires mask wearing. It requires hand washing. It requires social distancing. It requires getting a vaccine when you have access. And we are going to use every opportunity to continue to convey that. And we understand as human beings that people are starting to feel better. The weather's warmer. There's toilet paper on the shelves, whatever it may be. But if we are going to get to the point of defeating this virus, we need to remain vigilant. So I think it's a reflection of that. And I would certainly defer to them on any predictions of the trajectories. But as you noted, we've seen in the data that we've seen an uptick in some places. And we wanted to reiterate that given the opportunity.
Speaking with mayors or governors, asking them to hold off on lifting restrictions like we've seen in other places?
Well, Jeff Zients has a weekly call with governors that takes place every Tuesday. The president also engages with a range of elected officials, and I am certain he will convey exactly that message when he speaks publicly about this issue again.
You said that you were finalizing details for press access on these border issues. Can you commit to that happening this week? And since the administration, the president's brief, lots of different people at different staff levels have access to many kinds of photos, can you provide, although we would prefer independent press coverage, can you provide photos to show the public now so we can have more than relying on the congressional delegation?
Well, we're working on independent press coverage. We believe that that should happen and that should be the case. And I don't pull the levers here. I wish I was that all powerful. I am not, but I can just reiterate our commitment to transparency, and I certainly hope to have an update for you very soon, but I can't give you a deadline on that.
But photos you already have possession of could be shared with the public. Why not?
Well, we're going to give you access to the facilities so that the press can have access themselves. Thank you, everyone, so much.
Thank you.